everyone, so let's move towards our today's topic, which is
MIDGUT. Okay, as you know that we have talked about the development of GIT, and in development of GIT we have talked about the foregut part. As I told you that there is a gut tube that divides into three parts: midgut, hindgut, and foregut, midgut, and hindgut. And we have already discussed about the foregut. Now in this lecture we will gonna talk about midgut. Now midgut develops into the derivatives of the midgut are small intestine. Like you know, the proximal part of the duodenum develops from foregut, whereas the whereas the distal part of the midgut of the duodenum and the remaining parts of the small intestine are developed from the midgut. The cecum, the colon, and the appendix are also formed by midgut. Now, what happened? Midgut gradually forms. It is the middle part of the gut tube, and it further develops. And due to the rapid growth of the liver and the kidney, there is no space. There is no much space in the abdominal cavity. So, what happened? The midgut will form a loop, and that will enter into the umbilicus. Okay, the umbilicus. Okay. Now, what happened? That loop, that is U-shaped loop, which is formed, and the midgut will form U-shaped loop that consists of two limbs: the caudal limb and the cranial limb. And between those limbs, superior mesenteric artery is present. That means the U-shaped loop of the midgut is formed around the superior mesenteric artery. Remember this point. Now, what happened? Like I told you, that caudal limb and cranial limb. Now what happened? Rotation. We have discussed in the stomach part that there in the development of stomach, that rotation will occur in the stomach at 90 degree. But in midgut, if I talk about development of midgut, what happened? The midgut will rotate two times. The first, it will rotate at 90 degree. Due to which, what happened? When they will rotate 90 degree, when the midgut rotates 90 degree, what happened? The cranial end will become will come on the right side, and the caudal limb will come on the left side. Okay. Now what happened? The cranial limb form intestinal folds, intestinal swellings, which forms coils of the small intestine. As you know, if you see the developed structure of the small intestine, you see many coils, many turns in the small intestine. So basically that is formed by the intestinal loops, which is present in the cranial limb of the midgut. And if I talk about caudal limb, so it will form cecal swelling, which will form cecum. Okay. Now cecum and appendix. Now what I told you, that first rotation will at 90 degree. The second rotation is that 10th week is will take place at the 10th week. And what happened? It will rotate again during 10th week. It will rotate again at 180 degree. First it will rotate 90 डिग्री. ओके, पहले कैसे रोटेट हुए थे? 90 डिग्री पर. लेकिन जब दूसरी बार रोटेट हुए तो दैट विल बी 180 डिग्री. एंड ड्यू टू द सेकेंड रोटेशन ऑफ द मिडगट, व्हाट हैपन? All the organs, all the intestine, cecum, and all the organs of the abdomen will achieve their final location. Okay, obviously they will further develop, but the location, the place will be final at 10th week due to the second rotation of the midgut. So this was the main important point. So obviously, like I said, midgut बन गया. Now foregut के बाद midgut. अब now what happened? Hindgut will develop, and for hindgut I have recorded the lecture separately, so you can watch that lecture. But remember these important points regarding rotations and regarding the development of GIT and the gut tube. Till then, work hard, study hard, and good luck. Bye bye. Thank you.